Happening right now at the state capitol, the Senate working its way through a series of bills.
One would change the definition of healthcare provider in Louisiana, including those who work in administrative managerial roles or as support staff.
Our Capitol correspondent Alexis Maroney has details on why this bill is gaining so much attention.
Critics of the bill have dubbed it the Bob Dean Protection Act, naming it after the man who abandoned more than 800 nursing home residents in warehouses during Hurricane Ida. More than 3 years ago, hundreds of nursing home patients were left in unsanitary warehouses during Hurricane Ida. Investigators determined that patients received improper care and lived in inadequate conditions. After many patients or their families filed lawsuits against Dean.
What happened with Bob Dean's nursing home after Hurricane Ida was a spectacular example of neglect and mismanagement and administrative negligence.
State Senator Thomas Presley worries that the number of lawsuits against nursing homes in Louisiana will hurt the industry, though his team says their bill is not related to the lawsuits after Hurricane Ida.
And from everything I've read in media accounts and everything I've read from the pleadings, what is alleged against Mr. Dean was not just mere accidents. It was something much, much worse.
Presley's bill would change the definition of healthcare provider. People who perform administrative duties and those who provide care in a supporting capacity would be included.
It appears to me that the wording in this is very broad and very encompassing, and everything would be malpractice.
The goal, as Presley described it, would be to clean up definitions and reduce the number of lawsuits filed directly against nursing home management companies.
And we're not asking for immunity. If there's administrative negligence,
as close as it gets, Mr. Hadaway.
If there's administrative,
it's that close to.
If there's administrative negligence, then it should be covered by the cap.
Chip Wagar says more healthcare workers will be covered by the state's malpractice laws if the bill passes, and that would limit how much can be paid out after a successful lawsuit.
They want to get under the Medical Malpractice Act so that no matter what the injury or death is, the maximum they have to pay is $100,000. They don't want to be held accountable for that. That's why we're here.
If the bill passes, it would go into effect August of this year. At the Capitol, Alexis Maroney, WBRZ News 2.
Also at the